Welcome to Study and Careers.
Hi friends, welcome back.
Today, we have an important topic.
Yes, today's topic is at the doctor and hospital.
This lesson is for beginners.
A1 English, very easy.
We will speak slowly.
We will use short sentences.
We will teach useful words and lines.
You can use them in real life.
Okay, let's begin.
Paul, many people feel nervous at a hospital.
Yes, new place, many people, many rules.
Also, we may feel sick.
And we want help fast.
If we know simple English, we feel safer.
We can explain our problem.
We can answer questions.
We can follow instructions.
Today, we will practice all steps
From reception to pharmacy.
and also emergency words.
All safe and simple. Now we learn important words. Repeat after us.
Doctor,
Nurse,
hospital,
clinic,
reception,
front desk,
appointment,
patient,
waiting room.
symptoms,
Symptoms mean signs of sickness,
pain,
fever,
cough,
cold,
sore throat,
headache,
stomachache,
toothache,
back pain,
allergic,
medicine,
prescription,
test,
blood test,
x-ray,
report,
injection,
pharmacy,
insurance,
ID card.
emergency.
Great!
These words help you talk.
Yes, very helpful.
Hospitals have many places.
Let's learn them.
Reception desk,
Waiting room,
doctor's room,
nurse station,
pharmacy.
laboratory,
Lab means place for tests.
X-ray room,
Emergency room.
restroom.
Good.
If you are lost, ask, "Where is?"
Simple.
Sometimes we make an appointment first,
You can call the clinic.
or go to reception.
Use these lines.
Hello, I want an appointment.
Can I see a doctor today?
Is the doctor available?
The staff may ask, what is the problem?
You can say, "I am not feeling well,"
Or, I have a fever.
or "I have a cough."
Short and clear.
Now you arrive at the clinic or hospital.
Go to the reception desk.
Start polite,
Say hello.
or "Excuse me,
Then say,
I have an appointment.
or
I need to see a doctor."
the receptionist may ask, what is your name?
You say, "My name is blank."
They may ask for ID.
You say, "Here is my ID."
They may ask, do you have insurance?
You say, "Yes" or "No."
Very simple.
Sometimes you fill a form.
A form asks basic information.
Name,
Age,
phone number,
address.
emergency contact.
If you do not understand, ask.
Say, "Can you help me with this form?"
Or, what does this mean?
It is okay to ask.
Staff will help.
After reception, you wait.
Waiting is normal.
You may hear your name or a number.
If you want to ask time, say, how long is the wait?
Or, "When is my turn?"
Turn means your time.
If you feel worse, tell staff.
Say, I feel worse.
Or, "I feel very sick."
Short and clear.
Now, Body parts. Repeat after us.
Head,
Eyes,
ears,
nose,
mouth,
throat,
neck,
chest,
back,
stomach,
arm,
hand,
leg,
foot.
tooth.
Good.
These words help you show pain.
Now the nurse calls you.
The nurse may say, "Please come."
You go with the nurse.
The nurse checks your temperature.
Temperature means fever check.
The nurse checks blood pressure.
The nurse checks weight.
The nurse may ask, "Do you have pain?"
You can say yes.
Then the nurse asks, "Where?"
You can point and say here.
Easy.
Now, pain words.
You can say, "It hurts."
Hurts means pain,
You can say, "A little pain."
or a lot of pain,
You can say, "It is strong."
or it is mild.
Mild means not strong.
If you can't explain, just point.
Yes, point helps.
The doctor often asks time.
Like, how long?
You can answer with days,
1 day,
2 days,
3 days,
or weeks.
1 week.
Another question, when did it start?
You can say, "It started yesterday."
Or it started 2 days ago.
Very simple.
Let's practice common symptoms.
Fever,
Cough,
cold.
runny nose,
Runny nose means nose water.
sore throat,
Headache.
nausea.
Nausea means you feel like vomiting.
For A1, say, I feel like vomiting.
Yes, that is easier.
Dizziness.
Dizziness means you feel your head is spinning.
For A1, say, I feel dizzy.
Good.
Now you meet the doctor.
Start polite.
Say, hello, doctor.
The doctor may ask, "What is the problem?"
Answer with one sentence.
Example, "I have a fever."
Then add one more sentence.
I have a cough.
Then add time.
For 3 days.
Perfect.
Simple steps help.
Doctors ask many simple questions.
Let's practice.
Do you have fever?
You say yes or no.
Do you have cough?
Yes or no.
Any pain?
Yes or no.
Where is the pain?
In my head. In my stomach.
Any allergies?
Yes, I have an allergy. Or no allergies.
Great.
Allergies are very important.
Yes, always tell the doctor.
Say, "I have an allergy." Or, "I'm allergic to blank."
If you don't know the name, say, this medicine is not good for me.
Or, "It makes me sick."
Clear and safe. Sometimes the doctor asks about the past.
Like, do you take medicine every day?
You can say, yes, I do, or no, I don't.
They may ask, do you have diabetes?
If yes, say, yes.
If no, say no.
If you are not sure, say,
I don't know.
that is okay.
Doctors give instructions.
For example, drink water.
Rest.
Take this medicine.
Do this test.
If you don't understand, ask.
Say, please say it again.
Or, please speak slowly. Or, can you write it? Writing helps. The doctor may give a prescription.
You take it to the pharmacy.
But first, ask these questions.
How many times a day?
Morning or night?
How many days?
Very useful. If you forget, check the paper.
Or ask the pharmacist.
Sometimes you need tests.
Like a blood test.
Or an X-ray.
You can ask, why do I need this test?
Or, what is this test for?
The staff may say, to check your body.
If you feel nervous, say, I feel nervous. Or, is it safe?
Good question.
Now you go to the lab.
Say, hello, I am here for a test.
Give your paper.
The staff may say, sit here.
Then they do the test.
After the test, ask,
When will I get the report?
report means results paper.
They may say, today or tomorrow.
Good. Now the pharmacy.
The pharmacist is the medicine person.
Say, hello, I need this medicine.
Give the prescription.
Ask, how do I take it?
Ask, how many times a day?
Ask, after food?
If you want a simple warning question, say, will it make me sleepy?
Easy and useful.
Sometimes a doctor says you need to stay. Stay means remain in the hospital.
This is called admit.
For A1, say, I need to stay in the hospital.
Nurses may guide you.
They may say, this is your bed.
You can ask, can my family stay with me?
Or, visiting time? Visiting time means when visitors can come.
Good.
Now, emergency words. Keep calm.
Use simple lines.
Please help me.
I need a doctor.
I feel very sick.
I have strong pain.
Please call a nurse.
These are safe and helpful.
Speak clearly.
Use a calm voice.
After treatment, you may pay.
Ask, how much is it?
Ask, can I pay by card? Or, I will pay cash.
Ask, can I have the receipt?
Receipt is proof.
If you need another visit, ask,
Do I need a follow-up? Follow-up means come again. For A1, say, do I need to come again? Perfect.
Now, role play. Reception.
Hello,
Hello.
I need to see a doctor.
Do you have an appointment?
Yes, I have an appointment.
What is your name?
My name is Paul.
Can I see your ID?
Yes, here it is.
Please sit in the waiting room.
Thank you.
You're welcome.
Paul,
Yes?
please come in.
Okay.
Do you have fever?
Yes, I have fever.
Any pain?
Yes, my head hurts.
How long?
2 days.
Okay, please wait for the doctor.
Thank you.
Hello, what is the problem?
I have a fever and cough.
How long?
3 days.
Any allergies?
No allergies.
Okay, take this medicine.
How many times a day?
2 times a day.
Before food or after food?
After food.
Thank you, doctor.
You're welcome.
Hello.
Hello, how can I help you?
I need this medicine.
Okay, take it 2 times a day.
After food?
Yes, after food.
How many days?
5 days.
Thank you.
You're welcome. Now repeat after us.
I need to see a doctor.
I have an appointment.
I feel sick.
I have a fever.
I have a cough.
My head hurts.
My stomach hurts.
I have an allergy.
How long?
2 days.
How many times a day?
Before food or after food?
When will I get the report?
Can I have the receipt?
Great. Now, tips for beginners.
Tip 1. Speak slowly.
Tip 2. Use short sentences.
Tip 3. Point to the pain place.
Tip 4. Ask to repeat.
Say, please say it again.
Tip 5. Write down instructions.
Or, take a photo of the prescription.
Tip 6. Keep your papers safe.
ID, receipt, prescription, report.
Good.
Friends, that is today's lesson.
At the doctor and hospital.
We learned words and sentences.
We practiced role plays.
Practice again at home.
Listen and repeat.
Thank you for watching and listening.
This is Study and Careers.
See you next time.
Bye.